My name is Dr. Joseph Mikhael. I'm a professor of medicine and a hematologist at Mayo Clinic in Arizona. And it's my privilege today to talk to you a little bit about the study that I presented just a few minutes ago, looking at the combination of Isatuximab, which is a new monoclonal antibody directed against CD38, in combination with pomalidomide and dexamethasone in relapsed multiple myeloma. Let me tell you a little bit about Isatuximab first. So Isatuximab, it used to be called SAR 650984, is a compound very similar to daratumumab that hooks onto the CD38 antigen on the outside of myeloma cells and recruits one's own immune system to help destroy that cell. But it does more than that. When it hooks onto the cell, it also tries to destroy the cell directly, but it also recruits other parts of the immune system, what we call the immunomodulatory effect, to help destroy the myeloma cells. Now, we've actually already shown that Isatuximab by itself, much like daratumumab, has a lot of activity in very heavily pre-treated myeloma patients with a response rate of about 30%, like we saw with daratumumab. But we wanted to, in this study, combine it with pomalidomide, because pomalidomide works by that immunomodulatory effect, because we were able to show in the lab beforehand that if we put these two drugs together, there's a synergistic effect. So they work better than really just the addition of the two. So I presented today a fairly early trial, a phase 1b trial, which was designed to show what is the best dose of Isatuximab when combining it with pomalidomide, but also to see how safe the combination was and how efficacious it was. We've recruited over 45 patients already, but I presented the first 26 today who were in what we call that dose increasing or dose expansion, the dose incremental cohort, where we gave the drug weekly for 4 weeks, then every other week, given at either 5 milligrams per kilogram, 10 milligrams per kilogram, or 20 milligrams per kilogram. Ultimately, we found that the 10 milligrams per kilogram was the right dose and the right matching dose to pomalidomide. A few things that we found doing this. First of all, the combination of these drugs are quite easy to give. Isatuximab, like daratumumab, has about a 50% chance of having an infusion reaction when a patient is receiving the drug, but we can almost always complete that infusion. We stop it for a while, we give further medications to reduce the infusion reaction, and are able to complete it. So the drug is very well tolerated because after that we saw very few other effects from the Isatuximab. We did notice, however, that there was a significant increase in dropping of white blood cell counts with these two drugs together. We know that pomalidomide can do it, but when we add Isatuximab to it, the counts drop a little bit lower. Now, the good thing was we didn't actually have to stop the regimen for anybody because of this, but we had to use a little bit more G-CSF and very often dose reduce the pomalidomide. Perhaps the most exciting part of the study was the response rate. So not only was it safe, we felt, and that it was tolerable to give, we saw a 75% response rate in that 10 milligram per kilogram cohort. If we look at all three cohorts, it was a 65% response rate. This is very encouraging because we would expect pom and dex on its own to maybe have a response rate around 30%. So we're able to double that by adding the Isatuximab. And perhaps the last comment I'll make is that for a patient's perspective, why I think Isatuximab is particularly important is we have a more concentrated version of the drug that we give over a more rapid infusion. So on average, the first infusion was just under 4 hours and the subsequent ones were under 3 hours, which is literally half the time that we need to give daratumumab, where often the first infusion is 8 and the subsequent ones are 4 to 5 hours. So we felt that this was going to be a very convenient and important aspect of this combination moving forward. We've recruited many more patients to the trial, hopefully at upcoming meetings, including the European Hematology Association. In a couple of weeks, I will be speaking again, and perhaps even at ASH this fall or this winter, we'll be able to update patients and scientists and clinicians on the study. And we've now also opened a phase 3 study where we're comparing Isatuximab pomalidomide dex versus pomalidomide dex, which is probably going to be the path with which this drug will ultimately be approved by the FDA. Thank you for your attention today.